Okay. So I just received the answer from one person, Arun. Let's see who are in the class. Received the answer. Gauri, Hanshini, Kashi, Kushi. Are you guys able to reach at any code or anything? Any doubts? Okay. Let's try to solve that question together. Then we will do another question that you need to solve. Then we will move further. So our question is old bucket handle tear of right medial meniscus. Of right medial meniscus. So now we have to refer the condition. So our condition is tear. Patient is having the bucket handle tear. So we have to refer tear in the manual. Here we have the P, so we have to refer T. So let's scroll it a little more. It's W. Scroll it up. Ulcer. Here we go. Here we have the tear. So patient having the tear of the medial meniscus, and that is old in nature. So under the tear, we have to refer meniscus, and in the meniscus we have the option for the old. If we refer the old in the manual, it says seat derangement, knee, meniscus due to old tear. So C means that we have to refer the different term in the manual to find out the code. So based on this, we have to refer derangement followed by knee, meniscus, and then due to old tear. So now let's go to the derangement. E-E-R. E-E. Here we have the derangement. Under the derangement, we have to refer the knee. So it's J. Here we go. Knee. Under the knee, we have to look for meniscus, followed by due to old tear. So under the meniscus, we have to look for due to old tear. Then it was at the medial end. Bucket handle, it's medial meniscus. So under the due to old tear, we have to look for medial. So our code is M23.20. Code will be M23.20. We have to complete this code also. We have to refer medial. So here we have the tick. That means we need to complete this code. So to complete this code, we have to refer the tabular. So we will pull M2320 in the tabular? Now, here we have M23.20. So our patient having the condition at the right end. So for right knee, is at medial, 20. So our answer should be M23.203 because patient having the condition at the medial meniscus due to the old tear. So Arun, you picked the M23.261, but the correct code should be M23.20. Did you get that why the code should be 23.20 instead of the 26? Hello, Arun. Are you able to identify the reason why the code should be 23? Oh, you just sent the text. Perfect. So I'm moving further. In the last session, I think we have covered till the chapter number 14, and from today onwards, we have to start the chapter number 15. Okay. I'm asking one more time. Does any of you have any questions, any doubts which you want to discuss before proceeding? Okay. Let's move to the chapter number 15. So chapter number 15 codes from series O00 to O9A. Any code belong from series O00 to O9A will represent the complications or the conditions during the pregnancy period, childbirth, and puerperium. Pregnancy period is divided into the three parts based on the week of gestation. So those three parts are first trimester, second trimester, and third trimester. So if the patient's pregnancy is 0 to 13.6 weeks, so that will be first trimester. If the pregnancy is 14 to 27.6 weeks, that will be considered as a part of second trimester. And 28 to delivery will be considered as a third trimester. So our majorly of O codes are divided into the three parts based on the trimester. Let me put two codes for you. Let's put O98, 45, 488. Here you can see that our code is divided based on the trimester, whether it's in first trimester, second trimester, and third trimester. So majorly all of the codes are divided based on the trimester of the condition. So you have to determine the trimester based on the week of gestation. If the pregnancy is between 0 to 13.6 weeks, you have to consider that as in first trimester. If the pregnancy is between 14 to 27.6, that will be your second trimester. And if the pregnancy is between 28 to delivery, that will come under the third trimester. So first trimester, 0 to 13.6 weeks. Second trimester, 14 to 27.6 weeks. And the third trimester will be 28 weeks to delivery will become under the third trimester. We do have a code for the puerperium. Puerperium period is 6 weeks after delivery. You will pick a code for the puerperium series when the pregnancy delivery is completed and the patient have the condition in 6 weeks after the delivery. So first O codes have for pregnancy. Pregnancy codes are further divided into three parts. Then we do have a code for a puerperium period that will represent a condition occurring between the 6 weeks after the delivery. We do have a code for the childbirth. You have to pick a code from childbirth whenever there is a complication during delivery. So if there is a complication during a delivery, in that case, you have to use a code from the childbirth series. Now let's get back to the guidelines. So your O code will represent any conditions occurring during the pregnancy based on the trimester. During childbirth is any complication occurring during the delivery. And the last one is during puerperium, which is in between the 6 weeks after the delivery. You have to use a O series for the mothers only, on the maternal cases only. So you cannot use any conditions to represent any condition for a baby. You have to use a series P for a baby. If there is any condition to the mother, you have to use a O series. And O series will represent any condition which is due to pregnancy or which is might be patient have that condition prior to the delivery or the pregnancy. In that case also you have to keep O series at the primary position. So whenever you are going to code for the pregnancy case, your first code should be O series, even though patient is having a simple vomiting. Still, you are going to look in the pregnancy, vomiting in the pregnancy instead of looking the vomiting directly into the index. So whenever you are going to code a chart for a pregnant woman, you have to make sure that your O code will be primary in all the situations. Your O code is primary. Then you have to use a specific code for a condition, specific code for the condition at the secondary position. And your third code will be week of gestation. That will be your third diagnosis. So even the patient have any pre-existing condition during the delivery, let's say patient have the type 1 diabetes, which is complicating her pregnancy. So first you have to refer pregnancy in the index. So any condition occurring during pregnancy, for that you have to refer pregnancy in the index only. Once you reach to the pregnancy, then you have to look for the complication. If it is in diabetes, you will look for the diabetes under the pregnancy instead of the going into the diabetes directly. You will find the code under the diabetes section. So whenever there is a condition to a pregnant woman, even though that condition is pre-existing, still you are going to find a code from series pregnancy. So you have to refer the pregnancy first. You have to find out the O code. You can see here. Yeah, our all codes are listed from series O. So first you have to find the O series for that condition. Once you reach to your code, then you have to look for a particular diagnosis code or particular condition code if patient have any pre-existing condition to represent the condition clearly or to specify the condition clearly. And at the end, you have to mention week of gestation. Week of gestation, to find the code for a week of gestation, you have to refer pregnancy only. Under the pregnancy, you will look the particular week of gestation. You will find out the code for a week of gestation, then you will proceed further. So whenever there is a pregnant lady, first you have to code O series, followed by the condition. And to find the condition code, you have to refer condition directly into the index. And to find out the O series, you have to refer pregnancy in the index. Then your last code will be week of gestation. Next code will be week of gestation. Clear till now? Any doubts? Any questions? I think no doubt, right? What I'm going to do, I'm going to send one question over the group. Take 2 minutes, try to solve that question. If you guys are not able to solve, then we will do it together. It's 3:25, solve that till 3:27. Are you guys able to reach to any code? Okay, let's discuss this question together. So now we have discussed that our primary code should be O series. That you did very well, very good for that. Your last code for the week of gestation, that is also correct. Now let's try to solve this question together. So patient having the bladder abscess and patient is 25-week pregnant. Okay, so as this condition is during pregnancy, what we have to do, we have to refer the pregnancy in the index, and in the pregnancy we will look for the abscess. You can see here under the abscess we have the bladder here, but this is an incomplete code, so we have to complete this. Let me mention the code here, then we will complete this later. So it's O23.1. Then we have to look for week of gestation, that will be under the pregnancy only. So So based on the documentation, patient is 23-week pregnant, not 23, it's 25-week pregnant. So under the week of gestation, we have to look for 25. So here we have 25. So our code should be, our last code should be Z3A.25. Now we have to look for the condition specific diagnosis also. So find out the code for condition specific, we have to refer the condition in the index only. So condition is abscess. So we will try to find the code for abscess in the index. Oh, try to find the code. Here we have the abscess. Under the abscess, we have to look for the bladder. So it's E here. We have to scroll it up. Bladder. BLA. Here we go. Here we have the bladder, which tell us that we have to refer cystitis, then specified type NEC. So first we have to refer the cystitis, then we have to refer the specified NEC. So let's try to find out the code for the cystitis. Ahmed, did you have any questions? Would you like to ask something? Ahmed, did you have any question? Okay, let's try to find out the code for cystitis. So here we have the conversion. We have to scroll it down. Here we go. This is cystitis. Under the cystitis, we have to look for specified type NEC. So our code is N30.80. So for this question, we should use these three codes. Our first code should be N023.12. Second code should be N30.80. And our third code should be Z3.25. So whenever you are going to code any condition for a pregnant woman, you have to make sure you should use at least three codes. Your first code should be from the pregnancy, because pregnancy code will not classify or define your condition properly. It is necessary to use the code from the other chapter to define the condition completely. So let me go and pull the description for the O23.12. O35. Here we go. So you can see here, O23.12 will tell us infection of bladder in pregnancy. It will not tell us that patient is having the abscess in the bladder. So it is very obvious that we should not have all the conditions listed in the O series. So what we have to do, we have to use a code from series O first, followed by the condition, and then we have to use a code week specific. So now let's start with the guidelines. So first guideline is general rule for obstetric cases. So first guideline will tell us that our code from chapter 15, that means O series, will always supersede and will take sequencing priority over all other chapter codes always. So it will tell you that whenever you are going to use a code from series chapter 15, any obstetric cases, in that case you have to keep chapter 15 code at the primary position followed by the other chapter codes. So your chapter 15 code should be your primary diagnosis, and other chapter code will be your secondary diagnosis. If your doctor is not treating anything related to the pregnancy and a doctor is providing the treatment which is incidental to the pregnancy, in that case you are going to use a code with the normal condition code without O series, and the end of the charge you will mention Z33.1 to represent that the treatment which is provided by a doctor is not related to the pregnancy or incidental to the pregnancy. Now let's move to the other guideline, chapter 15. So as we already know that we have to use chapter 15 codes only on the maternal records. We cannot use these codes for the baby or anyone else. Once the woman is pregnant, then only you can use this code. Otherwise, if the woman is not pregnant, you should not use any code from the chapter 15. You can use the chapter 15 codes whenever there is any condition which is related to the pregnancy or due to the pregnancy. In that case, or complicating the pregnancy, in that case, you have to use a code from series O. Then we have final character for trimester. As I already show you that all our O series or majorly of our O series are divided into the based on the trimester, and the trimester is further divided based on the week of gestation. So you can see we do have the codes for the first trimester, second trimester, and the third trimester. You have to pick first trimester when there is a pregnancy ranging between 0 to 13.6 week of pregnancy. Second trimester 14 to 27.6, and third will be 28 to delivery. If trimester is not the part of your code, we do have few codes where trimester is not the part of the code. In that cases, that is due to the because that condition happens during a particular trimester. Once the organ starts shifting, then that condition starts to occurring. So there are few codes where we does not have a trimester as a component of that code or a descriptor of that code. That is due to the because that conditions occur during that particular conditions only. Okay, I can see someone asked something. So Vaishnavi, you have asked that if there is a premature baby, do we have to add the gestational week? No, if there is a premature baby and you are working for coding for the baby, then you have to use a code from series P only. You should not use a gestational week. We do have a code from P series for the babies, which will tell us that what is the exact week of gestation at the time of the birth. So which we will discuss later. Okay, Vaishnavi? Perfect. So let's move further. Any complication occurs during the delivery, in that case you have to pick a code for childbirth series. If in childbirth is not the component of your code, in that case you can use a trimester when the baby has been delivered or the trimester of the delivery. In that case you can pick that trimester if the in childbirth is not the component of the code. Let's move further. Next, we have selection of trimester for inpatient admission that encompass more than one trimester. Let's say patient is admitted on 13 week and patient is still admitted and now patient is at 14.2 week of gestation. And that happens that patient is still admitted and the trimester has been encompasses. In that case, you have to assign a trimester code when the condition has been originated. And if you don't have the information that when the condition has been originated, in that case, you are going to pick a code from series trimester when the patient has been admitted. So whenever patient is admitted for the more than two trimester, in that case, you have to use a trimester code when the condition has been originated. If you does not have that detail that when the condition has been originated, in that case, you can use the trimester when the patient has been admitted or the encounter has been created. I'm going to mute myself for a moment. Take a moment and just go through with this guideline and let me know if you have any doubts. Just read this and let me know if you are still not able to understand this. Done with the reading? Any questions, any doubt? Shall we move further or would you like me to repeat this guideline one more time?
Can you repeat, ma'am?
Sure. So this guideline is simply says that there is an instances when the patient is admitted to the hospital for more than one trimester. Let's say if the patient is admitted at the 13th week and patient is still admitted and now it's in 14th week of gestation. So that's the case. So if that's the case, you have to identify when the condition has been originated. So if you does not have the detail when the condition has been developed or the complication has been developed, in that case, what you are going to do, you are going to pick a trimester when the patient has been admitted. Okay. Any question, guys? Shall I proceed? Okay, I'm considering you does not have any doubt, so I'm moving further. Next, we have unspecified trimester. Unspecified trimester means that you does not have the information of the week of gestation. When you does not have the information of week of gestation, in that case, what you are going to do, you are going to pick a code for unspecified trimester. But you have to make sure that you have to refer all the documentation to make sure that you does not have that information. Okay. Next, we have seventh character for the fetus identification. As you already know that we have a separate seventh character for each chapter. And the same way, we have a different seventh character for this chapter also. In this chapter, our seventh character code will represent the fetus affected. Now I'm going to pull the seventh character. Okay, here we have the seventh characters. So now in the chapter number 15, our seventh character will represent the fetus affected. It will represent the fetus affected. You have to identify the fetus when there is a more than one fetus. Then you have to tell them that this fetus affected and this fetus is affected. And this condition is specific to first fetus or the second fetus. So if the patient have the single gestation, in that case, you don't need to represent whether it's a fetus one or fetus two because patient have only a single fetus. So if there is a single fetus, in that case, your seventh character will be 0. If you are unable to determine, you clinically determine that which one is affected, in that case also you have to use a 7 character 0. And when it is not specified that which one is affected, in that case also your 7 character would be 0. So you have to use 7 character 0 whenever patient have the single fetus or you are unable to determine clinically which fetus is affected, and if it is not specified in the documentation that which one is affected, in that case your 7 character would be 0. You have to use 7 character 1, 2, 3, 4, 5 based on the fetus affected. It will not represent how many fetus patient have. It will just represent which one is affected. So let's say patient have the two fetus A and fetus B. And patient have the condition to the fetus B. So your 7 character would be 2 because patient fetus B have the condition. And let's say another condition. Let's say patient have the two fetus, but fetus A is affected, not the fetus B. So if the fetus A is affected, your seventh character would be 1. Remember, seventh character will represent the fetus affected instead of the number of fetus. It will just represent which one is affected instead of the number of fetus, that how many fetus patient have. Any questions so far? Any questions, any doubts? Reminder, you have to use seventh character 0 whenever there is a single fetus. You have to use seventh character 0 when you are unable to determine which one is affected. And you have to use seventh character 0 when the clinically you are unable, when it is not mentioned that which one is affected. So let's go back to the guideline. So you can see here, the seventh character will represent that which fetus is affected instead of the number of fetus. You have to apply the seventh character 0 when there is a single gestation. You have to use seventh character 0 when your documentation is insufficient to determine which one is affected. And if you have to use seventh character 0 when you are unable to determine which fetus is affected. So in these three cases, you have to use seventh character 0. And last, one more time, with the seventh character 0, you have to represent which fetus is affected. Let's move further. Next guideline we have completed week of gestation. Completed week of gestation means, now you guys have to tell me. We have already saw the codes for week of gestation. So let's say patient is 13.5 week pregnant. So in this case, will you choose the 14 week of gestation or will you code the 13 week of gestation? What is your preference? If the patient is 13.5 week of pregnant, so will you use 13 week of gestation code or you are going to use a code from series 14 week? Perfect. Someone
13,
answered
ma'am.
30. Perfect.
13.
So we are going to use 13 only. They will not use 14 until it's a complete 14 week of gestation. So this guideline saying the same thing, that our week of gestation refers to the full week of gestation. Example, if someone is 39.6 week pregnant, still we are going to use 39 week of gestation until unless it will not reach to the 40 completed weeks. Once it reaches to the 40 completed week, then we are going to use the Z3A.40. Otherwise, we are going to use the Z3A.39 only. Now let's move further. Next, we have selection of OB principle or a first listed diagnosis. OB principle and first listed diagnosis. So whenever there is a pregnancy, so in the pregnancy, either patient came with the condition, any complication, any issues, or the next situation is patient does not have any condition, patient just want to come for the routine checkup. Routine checkup. So whenever patient is coming for the condition, I already told you that you have to code the O series first, followed by the condition, followed by the week of gestation. Week of gestation. Condition. Even in the condition, we have two type of condition, that pre-existing condition or gestational condition. Gestational means pregnancy induced. Gestational. So if the patient is coming for a gestational condition, in that case, you are going to use a code from series O and the week of gestation. You are not going to use a code from a chapter specific or the condition specific code. Why? Because patient have the gestational condition. Gestational means that condition is due to the pregnancy. Gestational means pregnancy induced. Pregnancy, patient have the condition due to the pregnancy. So whenever patient have the condition due to the pregnancy, in that case, you are not going to use a code from series, chapter specific series. You in that case, you just have to use two code or series and week of gestation. If the patient have the pre-existing condition or that condition is not due to the pregnancy, in that case, you are going to use a code from series O, condition, and then week of gestation. And now let's move to the routine checkup. Routine checkup, and then we have the abortions also. Abortion. So, abortion. We will discuss about the abortion later. Now let's discuss about the routine checkups. So I'm scrolling it down. So whenever patient is coming for the routine checkup, patient does not have the condition as of now. Remember one thing, you have to quote for routine checkup only if patient does not have the condition. If the patient have the condition and the patient is coming for the follow-up for that condition, in that case, you are going to quote for that condition only. You are not going to consider this as a routine checkup. You have to consider it as a routine checkup only if patient does not have any condition at this moment. So, routine checkups are of two types. Normal checkup, when patient does not have anything, any condition, any issues, any risk, pregnancy is completely normal. And the another one is high risk pregnancy. So if the patient is coming for the normal routine checkup, for normal supervision, routine checkup is known as supervision. So if the patient is coming for the normal supervision or normal routine checkup, what you are going to do? You are going to use a code from series Z34. Our Z34 code are based on the gravida. Gravida will represent the number of times patient conceives the baby. So if it is in first gravida, let me pull this code in the index first so that we can review it together. Just a second. Number 5. So 338. So under the pregnancy, okay, you can see here under the pregnancy we have the option for supervision. Under the supervision we have a different code. Right now we are discussing about the normal. So you can see here we have the normal. Under the normal we have two categories. First and the specified NEC. You will determine first and specified NEC based on the number of gravida. If it is in first gravida, if it is in first baby, you are going to pick a code Z34.0. If it is anyone other than first, second, third, fourth, fifth, anyone other than first, you are going to use Z34.8. If the gravida is not documented in your documentation, you are unable to determine whether it's in first pregnancy or any other pregnancy. In that case, you are going to use a code Z34.9. So Z34.0 when it is in first, Z34.8 when it is other than first, and Z34.9 when your documentation does not consist any information about the gravida, whether it's in first pregnancy, second, or third pregnancy. Next we have So in the normal pregnancy, first code will be Z34 based on the gravida, and your next code will be the week of gestation. Week of gestation. So normal is easy. When patient is coming for a normal supervision, simple Z34 and Z38. You have to remember one thing: we cannot use Z series and O series together. You need to use Z series only if everything is normal, patient does not have any condition, even it's a patient does not have any risk also. If the patient is coming for the high risk pregnancy means, let's say patient had the history of the infertility, or let's say patient is more than 35 years of age or less than 16 years of age, or had a history of molar pregnancy, and any these type of condition where the pregnancy is become the high risk. So in that case, you have to use a code from series O09. So you can see here under the supervision, we do have the column for the high risk. High risk means patient does not have anything at this moment, but due to the previous conditions or due to the current situations, patient had the high risk of the pregnancy, or that this pregnancy may cause another risk issues or any other conditions also. So under the supervision, our first is high risk. The first one is due to the history of ectopic pregnancy. Let's say patient has the history of ectopic pregnancy. Patient had a history of fallopian tubal pregnancy or grand multiparity. That patient already gave the birth to the multiple use babies. History of infertility. History of in utero procedure during the previous pregnancy. So any history or any condition which is not affecting the patient at this moment, but that might create the risk of issues or to the current pregnancy. So in that case, you are going to use a code from series O09, and your second code will be week of gestation. So whenever patient is coming for the supervision, you have to make sure that you will code it correctly. You have to first determine whether it's a normal pregnancy or the high risk pregnancy. If it is a normal pregnancy, you have to use Z34. If it is a high risk pregnancy, you have to use O09. With the both of them, you have to code peak of gestation at the second position. Now let's move further. Any questions so far? Now let's move to the delivery. Delivery. So whenever patient is coming for the delivery, we have the two type of delivery codes also: normal and C-section. Normal and C-section. So normal means patient does not have any condition at the time of delivery. So that will be normal. So if it's a normal pregnancy, normal delivery, for normal delivery, you are going to use a code O80. And your second code will be week of gestation. And at the last, you have to represent outcome of delivery. Outcome of delivery. So when there is a normal pregnancy or normal delivery, in that case, you have to keep O80 at the primary position. You can use O80 even though patient had the condition in the previous pregnancy, but this delivery is completely normal. Patient is delivering vaginally and patient does not have any condition at the time of delivery. In that case, you are going to use code O80. Next, we have week of gestation. Week of gestation will represent the time of delivery. And at the last, in all delivery charges, at the bottom, you have to use a code from series Z37, which will represent that this is an outcome of delivery or termination of delivery. So, whenever patient is coming for a delivery, normal O series, and at the bottom, you have to make sure that it will use the additional code from Z37 to represent the outcome of delivery. Now let's move further. Let's say patient is coming for the complicated pregnancy and doctor need to do the C-section. So your first code will be condition which leads the C-section. So condition which is leading the C-section or reason of C-section, in that case, you have to keep that condition at the primary position. Your second code, any other comorbidities, any other issues, that will be your second code. Then week of gestation. And at the end, you have to use Z37. You have to code outcome of delivery. So if the patient is coming for the complicated delivery, first you have to code condition which is leading the C-section. Your second code, any other comorbidities. Your third code will be the week of gestation. And your last code will be the outcome of delivery. Any questions so far?
Ma'am, what are the things included in second diagnosis and C-section?
Let's say patient is coming for the C-section because patient had the baby is in the breech position. So your first code will be the breech presentation. And let's say patient already had the diabetes, gestational diabetes. So gestational diabetes is a comorbidity. So your gestational diabetes will be your secondary diagnosis. Then you have to use another diagnostic code for week of gestation, and in the end, you will use Z37. Here,
Yes, ma'am.
okay. So we have discussed about the delivery, we have discussed about the supervision, we have discussed about the pregnancy encounter. Now let's move further for the abortion. So let's say patient is coming for the abortion. And one more thing, any condition occurring during delivery. So for that, you have to refer delivery in the index. So if you want to find a code for the delivery, your complication occurring during delivery. So for that, you have to refer delivery in the index. And if there is any conditions occurring during the abortion, so in that case, you have to refer the abortion in the index. So I'm going to pull the abortion. abortion. ABOR. Typical abortion. So, for abortion, we have three types of code: spontaneous abortion and miscarriage. That is, spontaneous abortion is miscarriage. And then we have elective abortion, where the patient wants to abort electively. Okay. So, spontaneous abortion is further divided into the two parts: complete and incomplete. Complete and incomplete. Complete abortion means when there is a patient does not have anything related to the product of conception. So everything has been moved out of the body. In that case, we will consider it as incomplete. But if patient have anything which is retained in the body, which is related to the product of conception, then you are going to consider it as an incomplete. So the product of conceptions are fetus, amniotic sac, placenta. These are the product of conception. So the patient have anything which is retained in the patient's body, any product of conception which is retained in the patient's body. In that case, we are going to use incomplete. And if all the product of conception has been moved out of the body, in that case, we are going to consider it as a complete abortion. So complete abortion means nothing left in the body which is related to the product of conception, and incomplete means there is a retained POC. Retained POC means retained product of conception. Next, we have another abortion. If there is any complication related to the spontaneous abortion, spontaneous complete abortion, you are going to use a code from series 003.9. And if there is any condition which is due to the incomplete spontaneous abortion, you are still going to use a code from series 003. Next, we have abortion, two types: incomplete and complete under the spontaneous, and all the series or the complication codes belongs to the 036. We do have a code from series 007. We have to use 007 code when patient is coming with the elective failed abortion, any complication which is due to the elective abortion. So any complication due to the elective abortion which is failed, abortion is not completed. In that case, you are going to use a code from series 007. And next we have, if the patient is coming for the induced abortion, then we have to use Z33.2. And if there is any complication due to the induced abortion, you have to use a code from series 004. So your 004 will be any complication due to the induced abortion, which is completed induced abortion. You have to use a code from series 007 when the patient is coming with the elective failed abortion, and you have to use a code from series 003 when the patient is coming for the issues or the complication due to the spontaneous abortion. Any questions so far?
Ma'am,
Yes.
Hello.
Mm-hmm.
Ma'am, can you repeat?
The complete abortion point.
Yes, ma'am. Complete and last one, elective failed abortion.
Okay, देखो, elective failed abortion means patient is coming or patient attempt to do the abortion, but the abortion is not completed. In that case, we are going to use a code from series O07. And you have to use a code from series O04 when the induced abortion has been completed, but now patient is coming with any complication like patient develops cystitis due to that elective abortion. You are going to use a code from series O04. Patient developed the bleeding, hemorrhage due to the elective abortion. So in that case, you are going to use a code from series O04.6. So O04 series will represent the complication due to the induced abortion. O03 series will represent the complication due to the spontaneous abortion. And O07 will represent the complication which is due to the elective failed abortion. So if it isn't failed, abortion is not completed, elective abortion is not completed, you are going to use a code from series O07. Clear?
Yes, ma'am.
Okay. Give me a moment. Let me see if we can do any question together for the abortion. Okay. I have sent one question. Just try to find out the code for that. You just remember one thing, any complication related to the abortion, for that you have to refer the abortion in the index only. Shall we discuss this question together now? Okay. Let's try to solve this question together. So patient had the complete spontaneous abortion, but now coming with the UTI, that is urinary tract infection, an ultrasound is showing retained product of conception. So complicated. It is an incomplete because patient 2 have the retained product of conception. So we will use it incomplete because even though patient had the complete abortion few days back, but the retained product of conceptions are still there. So if there is a retained product of conception, we are going to consider it as an incomplete, even though doctor mentioned it as incomplete. So it is an incomplete ultrasound showing retained. So we have to use incomplete. We have to use UTI. UTI. So it's an urinary infection. So our code should be O03.38 instead of any other code. We does not need any other code here. We just need to attempt add one code only, O03.38. Clear? Any questions? Clear that we should not use a code from series O07 here because it's an incomplete abortion and it's a spontaneous abortion. We need to use a code from series O07 when it is an elective abortion. So patient had the spontaneous. So we are not going to use a code from this. Okay. Now let's move to the guidelines. Or you want to do any other question now? Do you want to attempt one question or shall
One
we
more.
move to the question? Okay. Let's do the question together. Reminder, any complication occurring during delivery, for that you have to refer delivery in the index. In the screen, I have referred the delivery documentation that what we have to follow in the delivery charges. So this question is belongs to the delivery. So make sure that you follow these instructions mentioned in the screen to find out the code. 2 minutes has been passed. Let's wait for 2 more minutes. Then we will discuss it together. Shall we discuss this together now? Okay, I haven't received any answers. Is anyone is attempting that question? Oh, received. Got it. So someone use O24, someone O32, someone O34. Now let's do that question together. So now you can see here in the question it was mentioned that patient is coming for the C-section due to the malpresentation. So whenever patient is coming for a C-section, we have to use these codes. First, we have to quote a condition which is leading to the C-section. Then we have to use a comorbidities, any other comorbidities if there's any. Then week of gestation and then outcome of delivery. But I can see you guys only use the one code. So this is incorrect. Now let's try to solve this question together. So any condition which is leading to the C-section or having at the time of delivery, to find that code, you have to refer delivery in the index. Here we have the delivery. Now in the documentation, it was mentioned that obstructed labor. So in the delivery, we are going to find out the obstructed labor. Here we go, obstructed labor. And patient is having the foot-link presentation. So under the obstructed labor, we have to look for the foot-link presentation. So our code should be O64.8. You have to make sure that when you are going to quote a delivery charge, so the conditions occurring during the delivery For that, you have to refer the delivery in the index. So your first code should be O64.8. Then you have to complete. Okay. Now, after the footling presentation, I can see in the question it was mentioned that patient do have the diet controlled gestational diabetes also. So in the delivery only, let's try to find the code for diabetes. Here we go. So diabetes, gestational, it was diet controlled, I think. Yes, diet controlled. So our second code should be 24.420. Our comorbidities is O24.420. Then pregnancy is at the 38 week of gestation. So we have to use Z3.38. And in all delivery charges, we have to use week of outcome of delivery at the bottom. So what I'm going to do, I'm going to find a code for outcome of delivery. To find out that code, you have to refer outcome in the index. Here we go. Here we have the outcome of delivery. In our documentation, it was not mentioned whether it's a multiple delivery or anything. In this case, we are going to use Z37.9 to represent the outcome of it. Any questions? In this question, we have to use this code. We have to complete this one also. You can do it later, but we have to use these codes. So you can take the screenshot of these flow charts to determine how many codes we have to use for a particular situation. Now let's move to the guidelines. Or you need one more question. Guys, need any other question or shall we move to the guidelines? Okay, now let's start with the guidelines. So we have covered till the 7th point. Now we have to start the point number B. So B will tell us that what we have to use is in primary diagnosis that we can determine with the OB principle or a first listed diagnosis. First, routine outpatient prenatal visits. If it is in routine visits, we have to determine whether it's a normal visit or the high risk. If it is in routine normal, we have to use Z34. If it is in high risk, we have to use O09. And if the patient is coming for the delivery, we have to code O80 or the delivery type of delivery. And if there is no delivery and patient is coming with a condition or a complication, in that case, you have to code the complication, which is the reason of the admission at the primary position. When a delivery occurs, so whenever there is a delivery, first you have to determine whether it's a complicated delivery and normal delivery, which we just discussed. So if it is a normal, you have to use O80. If it is an complicated delivery, and for that we have to do the C-section also. So the one most related to the delivery or the reason of C-section will be a principal diagnosis. Any other comorbidities will be a secondary diagnosis, then week of gestation, and at the end you have to use the outcome of delivery. You have to use outcome of delivery whenever there is a delivery account. Whether it's a normal, whether it's a high risk, if there is a delivery charge, you have to use outcome of delivery at the bottom. Now let's try to find the code for the. Here we have the guidelines for the normal delivery. If it is in full term after 37 week of pregnancy and uncomplicated, there is no issues at the time of delivery, nothing complications. In that case, we are going to use a code from series 080. We will consider it as an uncomplicated even though patient had the complication in the past, but at the time of delivery it has been resolved. Still, we are going to consider it as an uncomplicated because at the time of delivery, patient does not have any complication or any conditions also. And even though it is a normal delivery, we have to use outcome of delivery at the end. We have to use the Z37 code to represent the outcome of delivery. Next, we have pre-existing condition versus condition due to the pregnancy. So we just had the word. Here we have discussed what we have to follow when the condition is pre-existing or the condition is due to the pregnancy. So if it is due to the pregnancy, you have to use O series at the primary position and then week of gestation. If it is in pre-existing, you have to use O series condition and then week of gestation. We have the same instructions here. So if there is a pre-existing condition, in that case, you have to use O series first because this is related to the pregnancy. You have to keep O series first at the both conditions. Then you have to use a code condition specifically. It is necessary to add a secondary code for the condition and then you have to use a week of gestation. We have a same instruction here also. Diabetes mellitus in pregnancy or the gestation. If it is diabetes, that means pre-existing diabetes, first you have to use a code O24. Then you have to use a specific appropriate code for the diabetes from E series. And if it is gestational, gestational means pregnancy induced. In the pregnancy induced, you will not use a code from series E because that condition is due to the pregnancy only. That condition is due to the pregnancy only. Next, we have abnormal glucose tolerance in pregnancy. So patient is unable to tolerate the glucose level. That is not diabetes as such, but there is an abnormal glucose level during the pregnancy. In that case, you are going to use O99.81. I have skipped the guideline number E. We will do that little later. So here we have HIV infection in pregnancy. So HIV infection is also a pre-existing condition. So in this case also, what we have to do, we have to use O series first, O98.7, then we have to O98.7, then we have to Z21 and B20, and then we have to use week of gestation. So week of gestation will be a third. First you have to use HIV, then type of HIV, then week of gestation. Next, we have sepsis, septic shock, abortion, pregnancy, childbirth. So I've already told you to find the code for the abortion. You have to refer the abortion. Any complication during the childbirth, you have to refer delivery in the index. Any complication during the pregnancy, you have to refer the pregnancy in the index. And for the complication during the puerperium period, you have to refer the condition and then postpartum or the puerperium in that condition only. Next, we have puerperial sepsis. Puerperial sepsis means patient developed the sepsis after the delivery. So for puerperial sepsis, we have a specific code O85 that needs to be used to represent the puerperial sepsis. With this code, we have to use a one more code to represent the organism, the causal organism of sepsis. So your first code O85, second code would be the causal organism, and causal to represent the causal organism, you will use a code from series B95 to B96. So to represent the causal organism, your code should be B95 to B96. And you have to make sure that your O85 will be primary diagnosis. And if there is any severe sepsis and septic shock, you have to code severe sepsis and septic shock separately. Next, we have alcohol, tobacco during pregnancy, childbirth, and the preparing. So the same thing we have to follow. We have to code the O series, with drug, then week of gestation. So first we have to use O series, then drug, then week of gestation. Now let's read one by one. So if alcohol used during the pregnancy, you have to use O99 primary. Then F10 at the second position, your secondary code will be the F10 to represent that this is an alcohol. Second guideline, tobacco use during pregnancy. Again, your first code O series, then you have to use a code from series F17 to represent the nicotine. If patient use any drug, you have to use O99 and your second code will represent the drug used by the patient. So you have to use a second code to represent the drug used by the patient. And if there is any poisoning, toxic effect, anti-adverse effect, or underdosing in the pregnant patient, in that case also, you have to use O series first. Then whatever the condition, whether it's a poisoning, toxic effect, underdosing. So whatever the condition, first you have to keep the O9A.2 followed by the specific code for the poisoning, toxic effect, or the adverse effect. So your first code will be O9A, then your second code will be the poisoning, toxic effect, and adverse effect. These guidelines are for termination of pregnancy. So if there is an abortion which ends up having a live-born fetus, so in that case, we have to use Z33.2, which will represent that patient is coming for the elective abortion or attempt termination of pregnancy. And in that, with this, you have to use Z37 to represent that live born has been born. So whenever patient is coming for the abortion, but that ends up with having a baby, in that case, you have to use Z33.2 first, followed by the Z37. Next is retained product of conception. So if there is any retained POC after the abortion, in that case, you have to consider it as an incomplete abortion. So if there is any retained, you are going to consider it as an incomplete, spontaneous. If there is any retained product in attempted or elective abortion, you are considering it as an failed termination of pregnancy. So if there is any retained product of conception, you are going to use a code from the incomplete section of the spontaneous abortion or failed section of the elective abortion, because there is a still retained product of conception in the patient's body. Any complication after the abortion or leading the abortion, in that case, we have to use a code from series O only in conjunction with the O4, 7, or 8 to represent the type of abortion. And if there is any hemorrhage after the elective abortion, what we have to do, we have to use a code from series O04, because any complication after the elective abortion, in that case, you have to use a code from series O04. So if it is an elective abortion after the of hemorrhage after the elective abortion, we are going to use a code from series O04.6 instead of the O72. When you can use O72? When there is a bleeding after the delivery. So if there is a delivery bleeding after the delivery, in that case we are going to use O72.1. But if there is any bleeding after the elective abortion, in that case you are going to use a code from series O04. Next we have abuse in pregnant patient. Abuse. In this case, we have to follow the same guideline. First, we have to use a code O series to represent the type of abuse, whether it's in physical abuse, sexual abuse, or the psychological abuse. Then we have to code all the injuries or the conditions which happened with the patient. And then you have to use week of gestation. So first O series, then condition specific, and then week of gestation. A very basic rule of the pregnancy guidelines. Next, we have COVID in the pregnancy. Same guideline as the HIV. First, you have to use a code O98.5, then COVID, then week of gestation. So in the whole chapter, we have the same guideline. First O series, then condition, then week of gestation. And the exception is gestational condition. So if the patient have any pregnancy induced condition, in that case you have to use O series and the week of gestation only. You are not going to use a code from series, condition specific code. Now let's get back to the guideline which we have skipped. Fetal condition affecting the management of mother. So if patient mother does not have any issues but the fetus have, and doctor need to treat the fetus through the mother, through the in vitro procedures or through the medicines. So doctor wants to treat the patient or the baby when he's in the mother womb through the mother. So in that case, we are going to use a code from series O35 to O36 because that individual is still in the womb. We are not going to use a separate code for that individual until unless patient got birth and have any other specific conditions. So if there is an fetus condition, in that case, you have to use O35 and O36 code. O36 and O35 will represent that condition. Fetus having the condition. So whenever fetus having the condition, we have to use a code from series O35 and O36. And whenever patient is treating the mother to treat the baby exactly, so we have to use 35 and O36 only. After the birth, if the baby have any issues, in that case, we are going to use a code from chapter 16 or P series. So if after the delivery, patient have any issues, baby have any issues, in that case, we are going to use a code from chapter 16 or P series. Now let's take one question and then we will move further. We will try to find out a question for the fetus only. Okay, try to solve this question. To find out any conditions happening with the fetus, you have to refer pregnancy in the index followed by the fetus. Two-minute has been passed. Let's wait one more minute. Okay, very good, Jamil. Now just complete this code or see if it is already completed and add week of gestation. Now let's do this question together. Patient is coming for the spotting. Very good. So you both send the correct answer. So patient is coming with the spotting. So we have to refer pregnancy because this condition is in the pregnancy. Under the pregnancy, we will look for the fetal because it's in fetus condition. Under the fetal, patient is having the hydrocephalus. Not patient, baby has the hydrocephalus. So O35.06. This is an incomplete code O35.06. O35.06. Now we have to complete this code. Completion, we will refer the tabular. Here we go, O35.06. It needs the 7 character. So 7 character is always listed on the top of the series. So in this case, patient have the twin gestation, but it is not mentioned whether the baby A is affected or baby B is affected. So what we are going to do, we are going to use O35.06X0 because it is not classified here. Your next code will be Z38.15 only. So for this question, you just need to use these two codes. So whenever there is any condition which is or any fetus condition when the baby is in the womb and for the fetus fish provider is providing the treatment to the mother, in that case we are going to use a code from series O35 and O series O36. Now let's move further. Next we have pregnancy associated cardiomyopathy. So whenever there is a condition, a patient have pregnancy associated cardiomyopathy. In that case, we have a specific code O90.3, which we can use even after the termination of pregnancy or even after the delivery. We can still use O90.3 because once patient develop the cardiomyopathy, it might stay there for 1 or 2 or 3 months, even after the termination or even after the delivery. So if the patient have cardiomyopathy which is related to the pregnancy or due to the pregnancy, for that we have a specific code O90.3, which might develop at the third trimester and may continue to have for the subsequent months after the delivery, and we are allowed to use this code even after the delivery. Next we have O94, sequela of complication of pregnancy. So if there is any complications after the pregnancy, after the termination of pregnancy, to represent that complication, we are going to use the code for complication, and second number we will use O94. So our O94 code will represent this complication is after the delivery or related to the previous pregnancy. Now Last thing we have here are in this chapter, peripartum and the postpartum period. Peripartum is a 6-month period which starts from the 9th month for the next 5 months. That's a peripartum period. Begins at the last month of pregnancy, and continues to the next 5 months after the delivery. And the postpartum is after the delivery for the 6 weeks. Any complication occurring during the peripartum or postpartum period, we are going to look at with the O94 series or peripartum and postpartum codes. We are not going to use a code from a different section. We are going to use a code from series O only, even after the delivery. Gold market, gold market. Then we have peripartum and postpartum complications. So any complication in peripartum and postpartum, we are still going to use the O series even after the delivery. Complication after 6 weeks, that comes under the peripartum. Still we have to use a chapter 15 codes to represent that this is a pregnancy related illness. And the last thing is admission for routine postpartum following the delivery outside the hospital. So if the patient gave the birth outside the hospital and now coming for the immediately follow up, that case we are going to use a code Z39. Any questions so far? Any doubts? Any questions? Any other? I got the answer from Jamil. Does anyone else have any doubt? Any questions? Okay, so now chapter 15 has been completed. I'm going to send you questions for the chapter number 15 too. And from next session, we will start the chapter number 16. Try to solve the previous questions also. And once you guys are done with your previous question and does not have any questions, then I will send other to. Thanks everyone. Bye bye.